Hello, I welcome you all in today's session. We are celebrating Women's Day this year by spreading awareness about cancer detection and care. The theme of this program is Yes, I can detect cancer early. Yes, I can survive cancer. In this series of events, we are talking various field experts about early cancer detection and care for women. Cancer is a disease that has potential to debilitate the life of a person physically, emotionally, and economically in a manner other ailments can. Women are custodians of our family health, playing a critical role in maintaining the health and well-being of our communities. In other words, healthy women will ensure healthy families, healthy communities, and a healthy nation.
So today we have Dr. Kumar Prabhash, who is a medical oncologist at Tata Memorial Hospital, Mumbai. Sir, if anyone gets diagnosed with cancer, the first thing what comes in everyone's mind is what stage the cancer is. So my first question with you today is, what is the various stages of cancer?
So usually the stages of cancer is put it as a stage 1, 2, 3, 4. But this is also true that not every cancer has a stage. For example, acute myeloid leukemia doesn't have a stage. You can have a risk category. But yes, usually what I said is true, that usually stages are 1, 2, 3, 4. And that depends upon tumor to tumor, how the stages makes a difference in the outcome of the patient and the treatment.
So when we specifically talk about lung cancer in India, it is one of the most common cancer in Indian population. So for women perspective, since this entire program is centered towards the women healthcare, women cancer care and diagnosis. So is lung cancer is quite prevalent in young women with smoking habits, or do we see any different pattern as compared to the male population in India?
So yes, there is a difference, and big number of patients in women, the lung cancer is a non-smoker. So that's a variation that in men it is more related to smoking as compared to in women, because smoking rate in India in women now also it is far lower than what we have seen in men. So yes, there is a difference.
Okay. So, I mean, if you see like percentage of occurrence of lung cancer in women versus women, would you see like major difference in that?
Occurrence of number wise, it looks like men predominant. It is more common in men as compared to women, and that's primarily because smoking habit is more common in men. So as far as the number wise, it is far more common in men as compared to women.
Okay. And what are the screening tests for early cancer, lung cancer detections for women or men?
Men or women. So at this moment, the screening test, which is by and large accepted and which has been shown that it does decrease the lung cancer mortality, is what we call low dose CT scan screening. And that is primarily in smokers, and that also primarily in heavy smoker. Yes, there is some data now to suggest that in non-smoker also the screening has some merit, and we need some more confirmation before we can say that it can be done routinely for everyone. But at this moment, it is primarily for people who are heavy smoker, at least 20 pack years, and usually beyond 55 years of age. Usually people say 55 to 75 or 74 years of age, but that subgroup is uncommon, especially in women. So more data on non-smoker and screening is required when we can say that they also can participate in screening. Otherwise, what I said routinely is important and usually accepted parameter for screening, and that's by low dose CT scan. There is some evidence for doing blood related tests to integrate in the screening, but at this moment that data is not mature, and one can refrain from at this moment recommending that should be routinely used.
Okay. Great. So as you know, like this entire program, what with the topic and other things, what we're talking about is mainly focusing on Women's Day. So what will be your message, final message to women regarding cancer care and how they can prevent themselves from being like cancer patient later in the future?
So regarding women, there are some common cancer in women, and primarily it is breast cancer and cervical cancer. The second one, cervical cancer, is eminently preventable, especially with some simple, simple things what we do in life. That is to keep yourself clean, keep yourself hygienic, and get one screening done. In today's time, something called Pap smear or VIA, screening, for which the study was done at TMH. So that is something for cervical cancer. For breast cancer, if you find any lump, please contact your doctor. There's some good data for screening in people beyond 45 years of age. But more important, if you find a lump, if you feel a lump, please contact the doctor. Both of the disease is also eminently curable if detected early, and if provided appropriate and adequate treatment. Today, with most of the scheme which is available for both these tumors, if detected early, the treatment can be delivered within those schemes, suggesting that it is possible and fairly cost effective for those treatment if these cancers are detected early, where there can be fairly cured with the disease if given appropriate treatment. And any other tumor beyond this, also in female, it does occur, and we should not miss those tumors. And in those tumor also, if treated, where there has been lots of newer development, the outcome can be improved, and they should not be denied the treatment where it is required. That's from my side.
Thank you very much for being part of today's discussion, sir. Thank you very much.
Thank you so much. Thank you so much.